Hi, my name is Pete Czekanowski. I'm going to be doing my pharmacology presentation on migraine headaches. Mark Lawrence said, "Some pain you can distance yourself from, but a headache sits right where you live." And that certainly feels true for anyone that's ever had a headache. Uh, Something I've always said, when your head hurts, you hurt. The pathogenesis of migraine is thought to be caused by the trigeminal vascular system, sensitization of the nerves spread in the head from the nucleus caudalis and the trigeminocervical complex. There's probably a genetic component, and there's a relationship with blood vessel dilation in the intracranial blood supply, excitability, and sensitization of the nerves. There's likely also a serotonin component, which causes neurotransmitters to release, inflammation causing chemicals around the dura mater and pia mater. Migraines have triggers in susceptible individuals. It could be a number of things, from foods, being tired, overworked, medication overuse headache, hormonal changes, certain lights or sounds, or any other environmental factor. 15% of adults have suffered migraine or severe headache in the last 3 months. Mostly women, 1 in 5 women, 1 in 16 men, and 1 in 11 children. And actually takes up a good chunk of emergency room visits at 3% of people just seeking relief. Good news is, as individuals get older, they're less likely to experience migraine. Clinical manifestations of a migraine is clinically a throbbing, pulsing headache on one side of the head is telltale migraine sign. It's usually made worse by lights, bright lights, loud sounds, exertion, physical activity. Some migraine sufferers experience aura, which differs from individual, but can be lights, sparkles, flashes, sounds, and oddly enough, smell and taste alterations, and then also just a vague feeling of malaise or dysphoria. And about 15 to 20% of migraine sufferers experience these auras. Other symptoms can be nausea, vomiting, which actually causes a problem when taking medication. If you throw up your medication right away, then you know you missed it. But if you throw up your medication 40 minutes after you took it, it's kind of a gray area. So sumatriptan is a medication that it comes as IM injection or sub-Q injection, which gets around that. And then there's some buccal absorption products as well to try to get around the vomiting. Muscle stiffness, increased urination, food cravings may be present. Something, a red flag to watch out for: a patient who describes their migraine as the worst headache of their life and they came on very quickly. It may be something more serious and should be investigated further. There are several other conditions that can present similar to migraine that are serious. An intracranial aneurysm may seem like a migraine. It could also have a stiff neck with a sudden severe onset and alteration in consciousness. So if that's the case, then a CT or a lumbar puncture should be used to rule this out. A tumor could also be cause of migraine symptoms, and we would want to assess that further. Or a cerebral venous thrombosis, a colloid cyst, or a Chiari malformation, or other serious causes that might present like a migraine. The medications used for migraine are from the basic ibuprofen, NSAIDs. They're convenient because they're over the counter. There is an anti-inflammatory component. They inhibit prostaglandin production and other inflammatory products. We don't want to take them in the 3rd trimester of pregnancy if there's any ulcerations in the GI tract, bleeding problems, patients should be educated on the GI effects of these medications and not to take them too much so they don't want to develop a medication overuse headache, which is pretty common in chronic headache sufferers. Another medication really that's the mainstay of abortive medicine for migraine is the triptans. So sumatriptan was the first one, and it remains pretty effective. So it's a serotonin 5-HT1 agonist, which the mechanism seems to be the receptors of the trigeminal nerve. Neurotransmitter activity is slowed, which prevents dilation of the vessels. Coronary artery disease or uncontrolled hypertension would be contraindications for this class of medication. Also, these can definitely not be taken with ergotamine derivatives because that puts the patient at a risk for vasospasm, and in particular coronary vasospasm, which would may result in death for the patient. So the patient should be educated about this if they have any chest tightness, warm sensation after use. Another medication similar to that is the ergot derivatives, ergotamine, and these were around before the triptans. So they have similar mechanism of action. It's serotonin 5-HT1 receptors are affected, but they're not as selective as the triptans are, and they do affect the vasculature of the heart more, and so they're a little bit riskier. And patients should be educated about these as well. Prophylactically, there's medications that are given for migraine, and that's an important part of chronic migraine control is prophylactic medication. So one common one is a atenolol, which is a beta blocker, and this has been shown to decrease the frequency and severity of migraines. It prevents vasodilation as well as increasing levels of extracellular serotonin. Contraindications to this would be bradycardia, bronchospastic respiratory condition like asthma, and the patient should be educated about bradycardia, low blood pressure, slow position changes. And something else that's important about this medication class is cold medications can cause unopposed alpha stimulation, resulting in hypertension and tachycardia. So the patient should be educated about this, and also not to abruptly discontinue this medication and to have extra on hand so they don't run out. My example prescription here is for Imitrex, sumatriptan by mouth. Take 1 tablet by mouth at onset, may repeat in 2 hours. Follow-up education. Patients with migraine headaches should maintain a headache diary. So this helps us track things like triggers, frequency, severity, duration, maybe what interventions the patient took. Did they put ice on their head? Did they take medication? We want to educate the patients not to take too much medication so they don't develop the medication overuse headache. Patients taking triptans, ergot derivatives, beta blockers, or calcium channel blockers should have their blood pressure monitored. Divalproex should have CBC and liver function monitored. And patients should be taught to try non-pharmacological methods like putting ice on their head, massage, relaxation techniques. And the patient should also be educated that the goal is to reduce the frequency and severity of migraines, and that they may not, in practicality, be able to completely eliminate their migraine. I hope you learned something from my presentation on migraines, and thank you for listening.